estimated almost 2/3 of nurses are members of the Royal College of Nursing. For the first time in its 106-year history, members nationally have voted to strike. The Royal College of Nursing said industrial action would take place at all NHS employers in Northern Ireland and Scotland, and all bar one in Wales. There will be walkouts at 121 NHS organisations in England. This is a health service in crisis, say the unions, with more than 47,000 unfilled NHS nursing roles across the UK and thousands more leaving, they say. We clapped for them, they clapped for themselves. And Prime Ministers, past and present, said, promising whatever they need. Because of being burned out and underpaid. The starting salary for a nurse is around £27,000. The most senior can earn around £55,000. But the Royal College of Nursing said pay has not kept up with inflation for years and is asking for an increase of around 5% on top of inflation, 17% in total. But the government said giving NHS workers that would cost £9 billion and simply wasn't affordable. Well, we now than you were a few years ago.
We're totally worse off. I know I'm worse off. For the first time ever that I really am having to think before I spend.
If you were starting out now, would you take this job?
No. And that does break my heart because it was something that I wanted to do from a young age.
Whereas you might have a trust further down in that region which has voted not to take strike action, but certainly you will see industrial action in all four countries, in England, Wales, Northern Ireland, and in Scotland too. Emergency and urgent services will not be affected. That's according to the RCN, the Nurses Union, and according to the government. It says it has contingency plans in place. In fact, next week, the NHS starts its winter preparedness exercises, Arctic Willow, which will test its winter preparedness and also test or stress test how well trusts are equipped to cope when industrial action does happen. I understand from speaking to union activists what has happened in the past in Northern Ireland when there has been industrial action. They have strike committees in hospitals which monitor the level of staffing on a particular ward. If staffing falls below that at any given time, then nurses who are on a picket line might be brought in to join other staff or colleagues on that ward, or they might have to shut that ward. So even though urgent and emergency care will continue and cancer care will continue, there will be disruption to elective care, routine appointments, and other forms of treatment. I asked Pat Cullen whether she felt conflicted by this and whether she had anything to say to a patient who might have been waiting for months to finally getting their appointment, to getting their routine procedure. What would she say to those patients who might be affected by those strikes? And she said, it's not in our hands, it's in the hands of the government. We are striking to make sure that patients who are waiting on that elective backlog can be seen quickly and effectively, and that's only if the government employs and recruits and trains and retains the nurses to make our hospitals work better. So she says it's in the hospital, she says it's in the government's hands. Also, the RCN is asking for 5% over inflation. Inflation currently running at around 12%. So they're asking for between 16 to 17%, way above what the government has already offered. I said, is that negotiable? And she says, we want to negotiate with the government. My door is always open. We want the government to come to the table and see what the government offers. So clearly there is some maneuverability there. There is a little room for negotiation. But the two sides, the government and the nurses union, so far apart at the moment, it looks like some strike dates will be announced and industrial action will be inevitable.
UK is battling a cost of living crisis. Amid this, nurses across the country have taken their first national action over pay dispute. They voted to go on a strike. The ballot was conducted among 300,000 members of the Royal College of Nursing. It was the biggest ballot in the union's history. The counting is still on. However, reports have indicated that enough members have already voted to go on strike. The strike is likely to take place before Christmas. However, the nature of the strike is yet to be determined. It is likely to disrupt operations and appointments. This as patients continue to face record waiting lists. The union is demanding a pay hike of 5% above inflation numbers. During his bid to become Prime Minister earlier in this year, Rishi Sunak had pledged to make public health services his #1 priority. However, the latest call for strike comes at a time when Prime Minister Rishi Sunak is tackling a $57 billion hole in public finances. UK has seen a wave of strikes in the recent months. This as citizens continue to struggle with the rising cost of living. Thousands of staff across industries have gone on strikes since summer. The union has also reported record number of vacancies of 25,000 jobs.